Parliament Select Committee on Health has described as satisfactory the ongoing COVID-19 testing at the airport. Chairman of the Select Committee on Health, Nana Ayuafriye, and Ranking Member Kwabena Minta Akando said they were impressed with what they saw with regard to the operational processes, and any other observations will be discussed privately with the airport authorities for solutions.
Provide parliamentary oversight. All you see here are honourable members of the Health Select Committee of Parliament. And constitutional mandate, among everything, is to provide thorough oversight on everything that has got to do with health within the confines of this country. So we were here today knowing very well that COVID is around. We want to understand the developments at the international port, which is a major port of entry. Most importantly, our ranking member about 2-3 weeks ago issued a statement, and that was the worry of Ghanaians at that time of the high rate of reported cases of COVID for passengers arriving in Ghana. We were on recess at that time. That was about 2-3 weeks ago. We came back to Parliament yesterday, so we thought it as a responsible committee of the people and for the people. We must come immediately to understand the dynamics and what is the situation as of now. So we came in today and we have gone through the processes from arrival before you take your luggage and you exit from the airport. And that to us is a core responsibility of ours, and it's ably discharged this morning. Thank you.
What were your initial observation of the processes here at the port?
Observations? To what to respond to.
Okay, first and foremost, let me add my voice to what Chairman has said. We came here to have first-hand information about what really happens as far as the COVID protocols are concerned. Let me indicate that we were warmly received. We've gone through the processes. We have certain reservations. We will have some meetings with some authorities before we leave here. And so far, I can say I'm impressed about.
The Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, who has been speaking on the management of confirmed cases of COVID-19 at the airport, says measures are in place to strengthen the current regime.
Very important. Once anybody who is tested positive, apart from being detained, you also get the sequencing is done for all those who are positive and detained. So they'll be able to pick up that. Apart from that, we are doing random sequencing from our labs to see the kind of variants we have in this country. But I must tell you that this antigen test, FDA has done a test between that and PCR. It is very, very, very comparable.
The Managing Director of the Frontier Health Services, Dr. Kujo Seneja, says the current testing system has been built to detect new variants. He says the company will ensure quality testing services.
System checks and they update it. That's one of our major costs. Regularly updating our system, so every new variant we make sure we can get it.
Can you clarify that again?
So saying that he asked about the variants, if the antigen can pick it up. And we're saying that we invest very heavily into that. We have regular updates of our system. Whenever there are new variants detected anywhere in the world, our manufacturers take that and update the system to make sure that you can get it. So we get regular reports on that, and that's one area where we invest in heavily as well. So far, it's been safe, picks all the variants. They have attested that the processes are superb and they are impressive. But we believe in continuous improvement. So we are reviewing on a daily basis and we see ways in which we can improve it as well.
They did mention that the initial figure that was $150 has been reduced now to $50 significantly for Ghanaians. And he mentioned that if it's left to them alone, they would want it more reduced so more Ghanaians can be able to afford that. Do you think that the reduction in the price is in any way going to affect the services that is being rendered here?
Definitely will if we have to reduce any further. And so It's a policy thing. It's beyond just us, and I wouldn't be able to talk into this fully.
Dr. Kujo Senaja there.